Did you hear that? Noise-induced hearing loss in oral health professionals. My name is Ricky Smith, and you will also be hearing from Ann Lynn, Melody Rosario Hashi, and Gwen Ross. Does anyone here have hearing loss? And do you believe it was caused by a work exposure? Growing up, my father was diagnosed with noise-induced hearing loss due to occupational exposures, and this has affected his life in many ways, which is unfortunate because they could have been prevented. Coming into dental hygiene, I never thought noise-induced hearing loss was something I had to worry about until one of my professors mentioned that she suffered from hearing loss, most likely due to working in a noisy environment. To my dismay, I too may be at risk for noise-induced hearing loss like my father. This possibility is what inspired us to explore this topic further.
With hearing this presentation, we will be defining noise-induced hearing loss, describe ways in which hearing loss relates to the oral health professional, recognize the prevalence of noise-induced hearing loss, identify the significant impact of dental equipment noise levels, and finally, provide examples of prevention and intervention. Here are the types of hearing loss.
The first type is auditory processing disorders. This is when the brain has problems processing the information contained in sound. The second one is conductive hearing loss. This is a problem with the outer or middle ear causing interference with the passing of sounds toward the inner ear. This is commonly caused by excessive earwax, fluid buildup, ear infections, damage to eardrum, or abnormal bone growth. The third one is mixed hearing loss, which is when you have both conductive and sensorineural hearing loss. Lastly, sensorineural hearing loss is caused by the damage of the hearing organ, which is the cochlea or the auditory nerve, resulting in the inability to send electrical information to the brain. Age-related hearing loss and noise-induced hearing loss is an example of this type of hearing. We have a brief video that shows you how sensorineural hearing loss occurs.
The human ear is fascinating. It's able to distinguish between 7,000 different pitches and enables the brain to locate sound sources. However, over 36 million people experience hearing loss. Of those people, 80% of them suffer from what is known as sensorineural hearing loss, caused by dysfunctions in the cochlea. There are fine hair cells responsible for sound transmission. The 3 rows of outer hair cells react to soft sounds and sharpen the differences between similar sound frequencies. The inner hair cells react to loud sounds. Together, they result in a smooth perception of the full sound range and a good separation of similar sounds. These fine hair cells can be damaged, for example, by injuries, illnesses, noise exposure, or regular wear and tear. In the affected areas, the nerve cells are no longer stimulated effectively, resulting in not enough or distorted impulses being transmitted to the brain for processing. Typically, it's the high frequencies that are affected first, as the respective hair cells are located at the entry of the cochlea, where every sound wave passes by. This usually leads to difficulty in hearing and understanding soft, high-pitched sounds, such as s or th, which in normal hearing help us to distinguish between words like pass and path. Hearing loss is a process that normally develops over many years, and no 2 cases are the same.
What is noise-induced hearing loss? It is a type of sensorineural hearing loss resulting from the damage of sensitive structures and/or nerve fibers of the inner ear caused by exposure to intense sounds. Although it is preventable, noise-induced hearing loss is irreversible and can occur gradually or suddenly on one ear or on both sides of the ears. This differs from age-related hearing loss because this type of hearing loss only occurs with age but does not affect all older adults. Age-related hearing loss is not preventable and is caused by various factors, such as changes in the middle and inner ear with age, medical conditions such as high blood pressure and diabetes, and medications such as chemotherapy drugs. So what are the effects of noise-induced hearing loss? A noisy workplace can contribute to occupational hearing loss. Individuals may not perceive a change to their hearing until their sensitivity to noise accumulates, causing a greater, much permanent degree of hearing loss. Not only can you not hear well, it can affect you both physically and emotionally, as well as with relationships, ultimately decreasing one's overall quality of life. The physical symptoms of noise-induced hearing loss can include distortion of sounds such as muffling, tinnitus, which is the ringing or buzzing in the ears, difficulty hearing causing an inability to comprehend, and difficulty communicating with others. The emotional symptoms include social withdrawal due to frustration from inadequate communications, low self-esteem due to judgment from others, depression and anxiety, and lack of ability to focus as hearing becomes impaired.
Sound levels are measured in decibels, which is a log scale. Above 85 decibels is considered to cause severe and profound effects on hearing. Therefore, the higher decibel sound, the higher your risk of noise-induced hearing loss. Your distance from the source of the sound and the length of time you are exposed to the sound are also important factors in protecting your hearing. A good rule of thumb is to avoid noises that are too loud, too close, or last for too long. Listed above are some decibel ratings for common sounds you might hear. Noise is one of the most common workplace hazards and can come in many forms: machinery, music, talking, and general background noise. These all apply in dental offices. High-speed handpieces, ultrasonic scalers in baths, suction, and people talking, just to name a few. Occupational exposure limits, or OELs, determine the maximum duration and loudness of noise that people can be exposed to throughout their workday without the use of hearing protection. According to the Canadian Centre for Occupational Health and Safety, the OELs in Canada are 87 decibels, but in most provinces, including Nova Scotia, the limit is 85 decibels over an 8-hour period. Quebec is the only province that has a different OEL, which is 90 decibels.
So how does it apply to oral health professions? The majority of studies we looked at primarily focused on dentists. They all acquired significant results, meaning dentists did experience some degree of hearing loss when using dental instruments. For example, a cross-sectional study in the UAE identified that the main noise source associated with noise-induced hearing loss was high-speed handpieces and high-volume suction devices. This study determined that noise-induced hearing loss had a prevalence rate of 22.2%. Although the results were statistically significant, the study did not specify what fell under the umbrella term of dental professionals, and no focus was specifically placed on ultrasonic scalers or dental hygienists. However, the same study also found that there's a positive correlation between years of experience and hearing impairment among dental health professionals. Therefore, the number of years practicing is proportional to the amount of noise exposure you have had, and so high-frequency noise has a high cumulative effect, which means that if you are exposed to it every day for 8 hours a day for 10 years, this puts you at a high risk for noise-induced hearing loss versus someone who has had the same exposure for 2 years. Despite the significance of this finding, the study did not factor in the natural process of aging and how it can contribute to the decline of hearing. Therefore, aging could be a confounding variable in the study. Limitations such as this warrant more research in this area of study. Here is a spectrum of dental instruments and equipment that can emit high-frequency sound, starting with the low-speed handpiece at 70 to 74 decibels, all the way up to the piezoelectric ultrasonic scaler at 107 decibels. As the decibel amount increases, the duration of this decibel exposure decreases. For example, you can be exposed to noise at 85 decibels for up to 8 hours, and this is within the safety limits. But if the decibel of sound increases to 88 decibels, time of exposure drops to 4 hours, and so on, because it is considered on a logarithmic scale.
To remind you of some of these noises, here are the sounds of each instrument respectively. Low-speed handpiece, high-volume suction, ultrasonic cleaner, lathe trimmer, ultrasonic scaler, high-speed handpiece, and the piezo.
So how can you protect yourself? Here's a photo of personal protective equipment. To the far left, you have someone zipping up their white coat, and the next person has a white coat, a mask, and glasses. The next person has white coat, glasses, mask, and gloves. And the last person has all of these personal protective equipment, except she's missing one important part.
How can noise-induced hearing loss be prevented? Know which noises can cause damage, those at 85 decibels or above. Wear earplugs or other protection devices when partaking in loud activities. If you can't reduce or protect yourself from noise, move away from it. And generally, be alert to hazardous noises in your environment. One way to prevent noise-induced hearing loss in oral health offices is by wearing hearing protection, which we will discuss next. The best prevention method for noise-induced hearing loss is avoiding prolonged high-decibel noises. However, this is not always possible. One of the ways we can protect ourselves from developing noise-induced hearing loss is through hearing protection devices, such as earplugs. The American Dental Association did a study in 2017 looking at 4 hearing protection devices, 2 passive and 2 active. The passive options included ETY silicone earplugs and laser light foam plugs. The passive options block all noises as their mechanism of action, so all sound will be muffled. Active options, like the Music Pro and DI-15 electronic plugs, filter the higher decibel noises and amplify the quieter ones so that you can hear someone talking. They surveyed dentists to see which options they preferred. However, the outcome can be applied to all oral health professionals. The results showed that active hearing protection devices ranked the best in ability to hear patients while using high-speed handpieces. As we know, hearing your patients and other colleagues is an important part of the profession. The ADA's survey found that other concerns for clinicians while wearing a hearing protection device included how easy the device was to use, how likely it was to stay in place, and how comfortable it felt in the ear. The electronic hearing protection devices have a variety of different silicone and foam inserts to suit your needs. There are some examples of insert options in the picture above. So what's next? It was clear that future research needs to be done specifically on dental hygienists and noise-induced hearing loss, since most studies pertain to dentists and dental assistants. You need to know what protection is out there and invest in hearing protection devices such as earplugs to block or filter noise, and also avoid higher decibel noises when possible to minimize your exposure. And get tested. Hearing tests should be completed at the start of the professional career to gather baseline data on hearing health so that you can monitor if there are changes throughout your lifetime. It would be convenient if this was done during training programs, which is a future opportunity between DAL and DAL Dentistry and DAL Audiology during orientation week. And regular hearing tests should be completed by anyone who's at risk, which I will discuss in the next slide. Here are a few options for hearing testing. Nova Scotia Hearing and Speech Centers have many locations across the province. Here in Halifax, they provide a wide range of hearing services from newborn testing to age-related hearing loss screening. The public location on Spring Garden Road is offered to clients of all ages and is free with a valid MSI card. As mentioned before, DAL Audiology has a clinic. It is open to all without a doctor's referral on Fridays from September to April. Appointments are 90 minutes and there is no cost. Assessments are carried out by the master's students, who are supervised by certified clinical audiologists. You can call the phone number or email them Attention Audiology Clinic to make an appointment. This information is available in our brochure.
What does this mean for dental hygienists? First of all, there is not enough focus on the risks for dental hygienists. Most studies that look at noise-induced hearing loss and oral health professionals are focused on how it affects dentists or the dental assistants. There are not enough research published that specifically focuses on dental hygienists in relation to risk and prevalence of hearing loss, especially in experienced dental hygienists. Secondly, dental hygienists use loud, high decibel equipment throughout the day during patient care. For example, ultrasonic scalers, which range from 68 to 75 decibels, can range up to 107 decibels when used on a continuous basis. Third, the increased use of ultrasonic scalers, together with high volume suctions, as recommended for reducing risk of aerosols, increases the level of noise on the decibel scale. This is a relatively newer practice, and we need more research into how using both in conjunction with one another can contribute to noise effects. Lastly, the hygienist's role in oral health is mostly on preventative measures to mitigate the risk factors for developing disease. We should not forget to protect ourselves from preventable hearing loss in the workplace.
From this research, we have learned the difference between noise-induced hearing loss versus other types of hearing loss. We have learned that the dental hygienist may be at risk for noise-induced hearing loss, and that hearing protection should be considered as personal protective equipment, and also the importance of getting your hearing tested.
In an oral health setting where there is a variety of equipment being used on a daily basis, oral health professionals are exposed to noise for long periods of time. This results in a high risk for developing noise-induced hearing loss. We need hearing because it is a key aspect for our well-being and it enables us to function at an optimal level. Hearing impairment at any level compromises communication, and it can play a big role in workplace safety. So get tested. Find out how well you can hear now so you can track changes over time. Dental hygiene is a preventative profession, and for the same reason tracking periodontal status and probing depths is important for your patient's health, we need to take responsibility for protecting ourselves in the workplace and prevent preventable diseases.
We hope from our presentation you become more aware of noise-induced hearing loss as a part of workplace safety, and we thank you for hearing us today.